Hi everybody, welcome to my channel. Today we're going to talk about online therapy. I'm Rita and today it's all about you. Distance communication in the relationship between the therapist and the patient. It's not new and exists already in the end of the 19th century. Sigmund Freud usually used to communicate through letters with some of their patients that live in the other part of the country or of the world. Since the beginning of internet in the 1983, self-help groups start to emerge. Today there are numerous sites offering any kind of help, information and support, as well as private e-therapy from clinicals and from mental health professionals. Online therapy is the provision of mental health services through internet instead of the traditional ways, like the normal face-to-face sessions. It is now possible to have therapy or counseling through email, real-time chat, any kind of phone services, or video calls and video conferences. These ways of communicate, particularly in therapy, increase accessibility, comfort, convenience and privacy. It is much more affordable, and for some specific disorders it is an important first step, not very intrusive, for treatments related with psychotherapy. And for this I mean depression, social phobias and psychotic issues. It usually fits very well the patient's daily life routine, but also fits in the perspective of the provider or the therapist, because this flexibility increases the quality of sessions, because it requires much less stress in the management of schedules, of places and spaces, allowing to better meet the needs of the patients. But as anything else, also has some disadvantages, and some of them are the lack of commitment from the patients that some therapists says that is a real problem, as well as the inability of reading the body language of the patient in some forms, like for instance with email or with the right form of this kind of therapy, that some therapists doesn't really like to not really sing the expression of a person when she is opening to some of their most deep issues. Some patients also say that it is much more difficult to reach a relationship with the therapist, so it's much more difficult to create an empathy bond or a positive trust relationship with the therapist when it's online therapy, or having issues with the data privacy protection that for certain patients can really be a big problem when using online therapy. E-therapy or online therapy is the present and the future of counseling in the mental health area. From one side, the patient has to make a deeper search and not just engage in any kind of website that says that provides online therapy. And in the end, it is ruled by people that are not professionals, but only people that really want to get the maximum profit of this kind of services. So it is important for you as a patient or as a person that is looking for online therapy to really look for the criterias of the people that are saying that are doing online therapy, and trying to understand if these are professionals in the mental health field. Online therapy really works and usually has very high rates from the patients that are using it, as well as from professionals in the mental health area. If you want to try online therapy, or if you know anybody that is in a search for an online therapist, I can leave my contacts in the description box below. You can really just scroll in my website, understand what is online therapy, and try to understand if this is something that you are looking for. And if you have any doubt, you can always send me an email, ask me your questions and your doubts, and we can even try to see if it's something that fits and if it's something that it is what you are looking for and what you are need. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel, leave a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video.